Wildly uneven and unfair. That's how the UN describes the distribution of COVID vaccines around the world. As rich nations scramble to buy up as much of the supply, many places are left out entirely. But today there's been a victory of sorts. Ghana has become the first country to receive vaccines through the Covax vaccine sharing initiative. They're produced by the Serum Institute of India. A total of 600,000 doses of the vaccine, developed by AstraZeneca and Oxford University, has arrived in the Ghana capital, Accra. But what about the Covax plan, and how can it help ensure that vaccines are shared fairly amongst all nations? The World Health Organization programme is aiming to deliver 2 billion doses to people in 190 countries by the end of the year. In particular, it wants to ensure that 92 poorer countries will receive access to vaccines at the same time that 98 wealthier countries. The scheme has so far raised around $6 billion, but says it needs at least another $2 billion to meet its target for 2021. Well, Thomas Nadi is in Accra for us.
The supply arrived this morning around 7 a.m. local time, and then the Minister of Health and other dignitaries were at the Kotoka International Airport to receive the vaccines. And so before these vaccines arrived, the country had decided to, the authorities had decided to educate people about the vaccines, the fact that it was safe for them to use and that it had gone through all the necessary protocols. So the rollout is expected next month, and it will be done between March and October. And they are targeting about 20 million Ghanaians.
And what's the response been there, and how are they deciding exactly who receives it?
Well, the response has been good because Ghana had seen a spike in cases, in COVID-19 cases. There was elections in December, and also because of the Christmas festivities, we saw a rise in cases. People abandoned some of the protocols. And so hospitals were overwhelmed with limited ICU facilities. The arrival of this particular vaccine has come as a great relief to health workers and a lot of Ghanaians. And now they want to prioritize only frontline health workers, and then people with underlying health conditions, as well as adults 60 years and above. But they'll also be vaccinating other frontline workers in the security agencies. We have members of parliament, the executive, and also the judiciary.
And do you know why Ghana was chosen for this delivery first?
Ghana has over the years been engaging in vaccination programs, and because of that, they've been able to build an effective vaccine infrastructure to be able to do this. And it's one of the reasons why UNICEF considered Ghana as the first country to receive these particular vaccines.
There in Accra. Well, I'm joined now by Edwin Ikoria, Executive Director for Africa for the One campaign, which aims to end extreme poverty and preventable disease by 2030. Thanks so much for joining us. Your reaction to this rollout today?
I mean, it's been long awaited, so it's really welcome development, very welcome news. And you can see the excitement already in Ghana in terms of being the first to receive these doses. So yes, it's really welcome development, and we've been really excited about it.
Can you just clarify how this whole system is working? Is this about donations from any nation that is able to going into a central pot, and then that it sort of buys up supplies from commercial vaccine makers?
No, the Covax facility, it's a multilateral framework that is really spearheaded by the WHO and Gavi. And the idea here is to pool fund and be able to access vaccines from the manufacturers themselves as soon as they become available, so that all the countries around the world, whether you have the financing or you don't, will be able to have access at least to critical vaccines that would take care of key populations like the health workers, like the aged people and all of that. The COVAX facility is aiming to reach about 25% of population in low-income countries. But this pool funding is, as it's designed, requires the support of the richer nations. And that's why it is really we're promoting that, because if they don't get that support, that initial access to these vaccines, in terms of the timing, which is also very important, wouldn't happen. And so it's not just about richer nations donating their doses, it's also about pool funding to be able to access directly from manufacturers as soon as it is available.
Yes, so how is it decided, for example, in countries which are manufacturing vaccine, like India in this case, others, of course, right around the world, whether they give that vaccine supply to their own domestic populations through domestic governments, or whether they supply it and redistribute it?
So it's not necessarily about the logistics of how it gets to the countries that need it. It's a bit complex. There are some arrangements that already happen within the Covax system that requires how prepared are the countries. So when vaccines become available, say for instance from India, the AstraZeneca vaccine, when it becomes available, which countries are ready, are prepared with a plan to be able to distribute immediately? Those are the kind of considerations that come into it. Now, for India, for instance, it has its own plan as a country, either as part of Covax or on its own. The African Union has its own plan as a continent, whether as part of Covax as well as independent procurement mechanisms. So it depends on what is available, who is able to make theirs available as at when it is due, and who has the plan to be able to distribute it as soon as it arrives. Those are the kind of considerations that take place. But it's about commitment first. So for instance, at the African Union, they have to have they basically pay for commitment so that when the vaccines are produced, just like rich countries have done already with manufacturers, they pay in advance. And once they get that commitment, they are able to then ship to them as soon as the vaccines become available. So the Covax is doing the same thing, making commitments, paying in advance for the vaccines to be available. As soon as it's available, it is shipped based on designs that they've already made to get to those who are ready and for distribution to take place.
Just very briefly, which countries need to step up more and in what way? Is this about basically getting more funding?
Yeah, the ACT accelerator or the Covax process itself needs more funding. It requires the main call right now is that the vaccines need to get to people on time. And if the Covax facility doesn't get the funding it requires, this is not going to happen. And this is the reason why the stepping up of the G7 nations has been quite very helpful in that sense. So that if they don't get the funding, it will take a longer time for the vaccines to get to those who need it. And that is the biggest challenge that we are facing right now.
A very important message. Edwin Ikuria from the One campaign, many thanks indeed for joining us.
Thank you for having me.